Okay, I'm going to do my head to toe. I'm just scanning my room. My computer has a clock with the live time on it, so I can, when I count my respirations, I'm just gonna set up over there. Okay, and I will now begin my assessment.
Come in.
Hi, my name is Sydney. I'm going to be your nurse for the day. I'm just going to do a head-to-toe assessment on you. Is that okay?
Yep.
Alrighty, I'm just going to wash my hands really quickly, and I'm going to provide us some privacy. Are you in a comfortable position right now?
Yep.
Alright, can you tell me your name and your date of birth?
Logan Benson, June 18th, 2006.
Perfect. And then I'm just going to raise the bed up to a workable height. And then what brought you in today?
I have a headache.
Okay. And then can you tell me a little bit more about that headache? When did it start?
About 2 days ago.
Okay, and then where's the location of that?
My temples.
Okay, and then is it a constant headache? Does it come and go?
I'd say it's constant.
All right, and is it a sharp, a dull, a stabbing, aching?
I'd say it's just like pressure.
Pressure, okay. And then anything that makes it worse?
Light.
Anything that makes it better?
Not that I know of.
Okay, and have you taken any medicine for that?
Tylenol.
Okay. And then on a scale of 0 to 10, 0 being no pain at all, 10 being pretty bad pain, how would you rate that?
I'd say about a 7.
Okay, alright. Alright, I'm just going to start. Going to inspect your head. There's no redness, no lesions in the scalp. There's no dandruff. Okay, and then I'm just going to palpate. Tell me if anything hurts. Anything hurt with that?
No.
Alright, and I'm just going to look at your face, making sure things are symmetric. Ears are symmetric, eyes are symmetric. Okay, alright. And then I'm just going to palpate your face. Tell me if anything hurts.
Okay.
Does anything hurt?
No.
Alright. And then where did you say that headache was at?
My temples.
Your temples. Alright, I'm just going to palpate a little bit more, okay?
Okay.
Does that hurt any?
A little bit.
Okay. Alright, I'm just going to conduct some tests, and I'm going to look into your eyes and stuff.
Okay.
Alright, just keep your head forward, and I'm going to shine a light. Okay, we'll do your other eye. Okay, and then I'm just going to look in at the conjunctiva. Okay, there's no drainage, no inflammation. The color is nice and pink, and the sclera is white. Okay, I'm going to look into your nose. There's no septal deviation. There's no drainage. And I'm going to look into your ears. And I'm just going to palpate the ears to see if I feel anything on them. Okay. I'm going to palpate the other ear. Look inside. Alright. Do you have any itching like in your scalp or anything?
No.
Okay. Do you have like any ringing in your ears?
No.
Do you have any blurred vision? Any like drainage in your nose?
No.
Alright, I'm just looking in your mouth. Okay. Uvula is in the middle. Mucous membranes are pink. Alright, teeth look good. And then I'm just going to have you smile for me. Frown. Puff out your cheeks. And then raise your eyebrows. Okay, and then I'm going to have you shrug your shoulders. Perfect. And then can you turn your head to the side and up a little bit? Okay. JVD is not noted on that side. And on the other side. Okay, JVD is not noted. And then can you chew for me? Okay, and then I'm going to give you this drink. Can you take a sip of it?
Okay.
Alright. Do you have any pain while chewing?
No.
Any pain while swallowing?
No.
Okay. Alright. Just going to do a few more questions. Do you have any surgical history, allergies, medical history, or family medical history?
No.
Alright, and I have a few more questions. Your name and date of birth again.
Logan Benson.
Okay, and then do you know where you're at?
Yes, your house.
Okay, and then what brought you here today?
I have a headache.
Okay, and then do you know the date and the like the month and the year?
Yeah, it's November 2025.
Okay, all right. And then we're gonna do some range of motion with your head. Can you turn to the side, the other side, and then front and back? Do you have any pain with any of that?
No.
Okay. All right. Now I'm just gonna go into my I have a few more things for the face. Can you look at the tip of my pin?
Yep.
And follow it to your nose. Don't move your head. Okay. And then I'm going to do the 6 cardinal fields.
Okay.
Go there. Okay. A few more. Okay. The pupils are round. They're equal, reactive to light, and the pupils are about a size 6 millimeters. All right. Now I'm just going to go into my respiratory assessment. I'm going to inspect the chest. And if I was able to, I would inspect and palpate and auscultate on bare skin. So look, and then I'm going to palpate where I'm going to listen. Okay, can you sit up for me? And then I'm going to palpate on the back. Okay, all right. And then I'm just going to start by listening to the 10 posterior sounds. The chest was symmetric. There is no use of the accessory muscles when breathing, and the chest had a nice like curve to it. All right. And then when I place my stethoscope, just breathe in and out for me. Okay, and I'm just going to do it on the front. I'm going to listen to your 8 sounds on the front. Okay. Breathing was clear and equal bilaterally. All right, now I just have a few questions for you. Do you have any shortness of breath?
No.
Any trouble breathing while laying on your back?
No.
Okay. All right, since I already inspected the skin on my respiratory assessment, I'm just going to palpate where I'm going to listen for my cardiac assessment. Okay. And then did you have any pain with that palpation?
No.
Okay. All right, I'm just going to listen. I'm going to listen both with the bell and the diaphragm of my stethoscope, and I'm going to start with my diaphragm first. I'm listening to the aortic. I'm listening to the pulmonic. I'm listening to the Erb's point. Listening to tricuspid. And I'm listening to the mitral. And I'm just going to switch to my bell. I'm listening to aortic. Listening to pulmonic. Listening to Erb's. Listening to tricuspid. And listening to mitral. Alright. S1 and S2 were heard at Erb's point while using my diaphragm, and no extra sounds were heard while using my bell. Alright, and I have a few questions. Do you have any chest pain?
No.
Do you feel like you are fatigued at any time?
No.
Okay. Alright, I'm just going to go to your arms.
Okay.
Alright, I'm just going to inspect your arms. The color is good. There's no abnormalities, no scars, nothing like that. I'm going to feel for temperature. The temperature is warm. And then I'm going to check for edema. Okay, there's no edema present. And I'm going to check for skin turgor. No tinting is present. And I'm going to check your cap refills. Less than 2 seconds. Can you squeeze my fingers? Perfect. And then I'm going to check your radial pulses. Radial pulses are presenting bilaterally. All right. Now we're going to do some range of motion tests, okay?
Okay.
All right. Can you lean forward and then go up and then back and then in a circular motion? Okay. Do you have any pain with that?
No.
Do you notice any swelling in your arms or anything?
No.
All right. We're going to get your abdominal assessment.
Okay.
All right. Is it okay if I lift your shirt?
Yep.
Okay. And then I'm just going to inspect. There's no redness, no abnormalities, no scars. And then I'm going to listen before I palpate. All right. I'm just going to listen until I hear vowel sounds in each quadrant. Okay. Vowel sounds are present in each quadrant. All right, and then I'm just going to palpate. Is that okay? Tell me if you have any pain or any tenderness, anything like that.
Okay.
Any pain?
Nope.
Okay. All right, and then I just have a few questions for you. Do you have any trouble urinating?
No.
Any trouble trying to pass a bowel movement?
Nope.
All right, you're good to put your shirt back down. All right, and then I'm just going to look at the legs. All right, I'm just inspecting. There's no abnormalities, no lesions. And I'm going to look at the bottoms of the feet. The skin is intact. Okay, and I'm just going to feel for temperature. Okay, temperature is warm. The skin is pink. Hair distribution is good. Okay, now I'm just going to check for some edema. There's no edema present. And then I'm going to check for skin turgor. There's no tinting. And I'm going to check for cap refills. Less than 2 seconds. And then I'm going to check your posterior tibialis pulse. Pulses are presenting bilaterally. And then I'm going to check your dorsalis pedis. Both pulses are presenting bilaterally. And then, can you push on my hands? Good. Pull back. Good. And then, I'm going to have you sit on the edge of the bed. Is that okay?
Yep.
All right. Can you bend your legs? Good. And then, can you just go out and around? Okay. Good. Do you have any pain with that?
No.
Do you notice any swelling in your legs?
Nope.
All right, you're good to lay back down for me. All right, I'm just gonna get some vitals on you. Is that okay?
Yep, that's fine.
All right. I'm gonna start with your blood pressure.
Okay.
Just gonna lift up your sleeve. All right. Okay. All right. Your blood pressure was 126/84. All right. And then I'm just going to place this pulse ox on your finger.
Okay.
And then I'm just going to get your temperature really quickly. I'm going to move your hair out of the way. His temperature is 98.4 degrees Fahrenheit. And then his heart rate is 66 beats per minute. And his oxygen is 98% SpO2. And then I'm just going to count your respirations.
Okay.
I'm just going to move this over a little bit. your respiratory rate was 16 breaths per minute. Okay. So I have completed my assessment. I'm just going to take this off of your finger. And then, are you in a comfortable position right now?
Yep.
All right. And then I have one more test to do. And then, are you able to swallow this for me?
Yep.
Do you have any trouble with that?
No.
Okay. So I've completed my assessment. I will update the provider with what I found today, and then we will get a plan of care going for you. Is that all right?
Yep.
All right, I'm just going to lower your bed back down, and then I'm just going to make sure you have your call light. I'm going to make sure you have your bedside table, and then thank you for letting me complete my assessment today. Again, I will update the provider, and then we will go from there, okay?
Okay.
All right, and then I'm just going to wash my hands before exiting the room.